It is Thursday, August 22nd, 2020. Watkonura de Zurwego, Joe Dalronio Jets, and welcome to our COVID-19 Task Force update. It is our 122nd update since the pandemic began back in March. Well, Lisa Westaway will be here in a few moments. She'll be talking about a variety of issues. But before we get to Lisa, we'll welcome one of our COVID-19 task force members who has not been on the program for a while. We'd like to welcome back our Chief Peacekeeper, Dwayne Zacharie. Dwayne?
Thank you. Good afternoon, Kahnawake. I hope everyone is safe and well. I just wanted to come on to the update today and talk a little bit about some of the issues and some of the stuff that we're seeing as we go along. All right, so every day the Kahnawake Peacekeepers receive a number of calls or complaints and concerns about people who they feel aren't respecting the social distancing or even the masking or even some of the hygiene issues, right? So I'm just getting on the show today to talk to you about what you need to do, right? We want people to be safe. This is just a friendly reminder. Lloyd's not on today, so he'd asked me to come on and talk about some of the things that the peacekeepers are dealing with on a day-to-day basis. And as I mentioned, every single day we receive calls or complaints, concerns, as I said, about people not doing what they should be doing. And, you know, like we get lots of calls, people call in and say, I'm really worried, I'm scared, I don't want to get coronavirus, what do I do? What do I do if my neighbors aren't listening? What do I do if I see people not following the rules? And we try to help them out as best as possible. And you know, if you're some of those people who have been called about, right, a peacekeeper always shows up at your door and tries to talk to you a little bit about being responsible and practicing the masking, distancing, and hygiene rules, right? That's something that Lisa Westaway had talked about on the last show, and I just want to reinforce it. We also get lots of calls about border crossing. And border crossing is something that's not in the purview of the task force, although we do field many calls about it. People are always asking about essential services. What does that mean? Do I fall into that category? So the only people that fall into the category of essential services are people who are either in fire, ambulance, police, somebody who works for a hospital, primary caregivers. You know, there's a long list, and you can go on the website for Canada and the border integrity site and see what essential service is. Just because your boss might say you're an important part of my business doesn't make you essential. You have to fall into certain categories, and if you don't, that doesn't give you the right to cross the border back and forth. We know that people are doing it, and the authorities at the border, they're trying to stay on top of it as much as possible. If you fail to follow the rules, you know, like when you cross the border, you're required to self-isolate. That means coming back, isolating yourself for 14 days, making sure that you're safe, making sure that you're not exhibiting any of the signs and symptoms. And once you complete your 14 days, then it's okay for you to start coming out again. But it's not okay for you to come back, come here, go out and go to Canadian Tire or go to any of these other stores without doing the social isolation first. You must self-isolate. You must stay in for 14 days. The border will, and you know this, when you get to the border, they take your information, even if they let you cross, you know, for whatever reason, because, you know, like you say you live in Kahnawake, so they're allowing you to return home, they're still going to check on you. They may contact us 10, 11, 12, 13 days later and say, can you check on this person to make sure that they're doing what they need to do? And we're going to check, and if you're not following the rules, we're going to have to report that back, right? And then you may end up in some kind of legal situation, right? So again, just so you know, it's not in the task force purview. So if there's any kind of border crossing or border issues that you have to contact the border directly. If you do have questions about it though, by all means, contact me here at the Peacekeeper station, and I definitely will fill you in and give you much more information on that. But I wanted to make sure that people were clear, because as we go along, and I know rules are changing and directives from the task force are also changing, and at this point, it feels a little bit like people are not, people feel like coronavirus is over and done with and there's something new on the horizon, right? It's not true. We're still here. We're still in the midst of the epidemic, and we need to all do our share. We all need to be responsible. We all need to make sure that we're masking, we're distancing, and we're practicing good hygiene. Because if we don't, right, we could run into the situation where we're passing on these germs, and you know, it doesn't take much for an outbreak. We've seen it in other communities, and as Lisa had mentioned last week when she did her update, the numbers are getting better, and they're only getting better because I feel like, and this is the feel-good part of my presentation, right? I feel like people are following the rules. We still have a few people who have a hard time doing it. And the reason I'm on today is to remind you, we need you all to come along, to follow along, to be part of the team, so we can all be safe and secure and see what it's going to be like getting back to our, I guess, as close as possible as what the old normal used to be, because I know you hear a lot about what the new normal is, you know, like with the schools opening and some of the issues there. The task force is working very hard. I'm really happy and pleased to be part of the task force. There's a lot of great people on there, and everything that they do is for the safety and security of Kahnawake. So if you have any questions, as I said before, you know, by all means, give me a call at the Peacekeeper station. If I can help you, I will. If not, I'll try and find somebody who can. And I'll leave you with this: masking, distancing, and hygiene. Those are the 3 big rules that you need to follow. Now.
Well done, Dwayne. Nice to see you again. It's been a while. Well, just 2 days ago, we saw Lisa Westaway, and she had a lot of information. She has more for you now, so let's welcome the Executive Director of the Catering Memorial Hospital Center, who is, of course, one of the mainstays here on the COVID-19 task force.
Thank you. Good afternoon. On Tuesday, I spoke about visitation at KMHC, and as mentioned prior, we do have, we've had up till now 2 Zoom meetings with families of residents in order to hear what is important to them and be able to meet the needs of families and their loved ones. And so what was requested at the last Zoom meeting was, was to move to the next phase of visitation, which would be to allow residents to leave the property of KMHC. So up until now, we've really been moving in phases and assessing the impacts of each phase, and we're happy to say that we're ready to move to the next phase, which is to go out for walks with your loved ones. And so we do have a protocol in place that has been validated by Dr. Gauthier, where we're looking at all safety precautions. So therefore we're able to allow residents to go out with a loved one for a walk on the bike path. So we do have, again, very safe protocols in place. So we would ask that if you're interested in doing so, when you call for a regular visit, so right now families are calling to book visits with their loved ones. So when you do call for your visit, you would simply state that you'd like to take your loved one out for a walk on the bike path. These visits are for 1 hour in the same way that they are on the floor or in your loved one's room. We'll go through all the safety precautions with you when you call and when we arrange the visit with you. So if you're interested, you can contact KMHC and book a visit to go for a walk on the bike path. It's actually a really good time now because the weather is not as hot, so it's a more appropriate and healthy time to be going out for walks. It was not the best time before due to weather, but also due to the possible risks, and so we've mitigated risk as much as we possibly can. Again, like we do in every one of our daily activities, we mitigate risk knowing that the virus still exists amongst us, as Dwayne mentioned so well before I came up here. I'm going to move on to more general information. We often talk about what's happening here in Kahnawake. We don't often talk about what's happening in Quebec, and I think that this information is pertinent for you to be aware of. So what Quebec has done recently is to evaluate the first pandemic, or the first wave of the pandemic. They've evaluated what went well, what didn't go well, and they've started already preparing for the possible second wave. Again, as we've mentioned, experts agree or disagree with whether we are in the beginning of a second wave or not. We know that we have sustained a lower number of new cases cases. We know that we still do have new cases every day, that we are mostly seeing cases in the younger age categories. But it's a good time, as our COVID task force is doing here in Kahnawake, evaluating what we've done up till now and how we can improve or do things differently in a second wave. Quebec is doing the same thing as well. So I'm going to give you a little bit of this information because you may hear it repeated in some ways in our own assessment of how we have done here in Kahnawake as we move forward. And again, we're working on that and we'll be presenting to you our plan in the coming weeks. So from the evaluation that Quebec has done, and as you already know, over 91% of the deaths that occurred in the first wave of the pandemic were in a population 70 years and over. And a big proportion of those deaths happen within different types of residences and mostly in long-term care facilities. So a lot of the recommendations for improvement in the future are in relation to those particular cases. So from their evaluation, they basically established 9 intervention strategies in order to be better prepared for the pandemic moving forward. And so the first strategy that they're working on is, of course, the residences for seniors. So they would like to improve communications between residents and family members, and improve communication regarding the directives in the residences with the general population. They also would like to ensure that there is responsibility and accountability within each individual residence, long-term care facility or private residence. They want to develop more clear roles and responsibilities for infection prevention control, and ensure that there are audits that are done on a regular basis so that measures are implemented on a regular basis. The second strategy or theme that they will be looking at, or that they're already working on, is regarding vulnerable populations. So we've spoken about seniors as a vulnerable population, but in fact, when we look at Quebec as a whole and areas that did not function all that well, we also are looking at the mental health population, people with disabilities and itinerants. So these are all populations whose services, considering that services stopped in many of these areas in order to allow us to respond to the pandemic, these populations, their care was impacted more seriously. And so again, there are many areas being looked at now to improve in order to better meet the needs of this population. A third strategy of intervention is HR related. And so what we've seen as a difficulty in Quebec is recruitment strategies. And so we've seen that there was a lack of resources in the public system or facilities. We've also seen that mobility of staff was an issue, so people working in more than one establishment carrying the virus back and forth, and our ability to quickly respond to HR needs depending on outbreaks in certain facilities or not, was also problematic. So these are all areas that will be worked on. A fourth area that needs to be improved is regarding screening and testing. And so we know that there was not always clear identification of who could be tested. So the priorities for testing need to be clarified and communicated. Also decrease in the future, a decrease in the delays for testing when we have large numbers of people that require testing. Right now we don't have any delays, but we could in the future. The ability to maintain our capacity for testing at a high level, because we know that being able to test, contact trace, and isolate is a hallmark in containing the virus. And so these are all areas that will be looked at in this fourth strategy. The fifth strategy is with respect to prevention and management of these outbreaks. So management and prevention. So prevention is related to infection prevention control, ensuring that that exists in all of our facilities, that we dedicate personnel to that responsibility, that training be in place for all staff and all personnel, that we process case management, so contacts, that we do contact tracing rapidly in order to contain the virus, and that there be extra resources added to public health in the future in order to be able to keep this up should there be many outbreaks. A sixth strategy is with respect to clinical reorganization. So one area we've talked about often is a secondary impact of the pandemic, meaning that we still do not have a very clear picture on the number of deaths that have occurred as a result of services that were not provided during the pandemic. And so one area that, that Quebec would like to work on in the future is to be able to maintain all clinical services, whether it be surgery, cancer-related services, radiology, to be able to maintain all those services despite the needs that we might have regarding the pandemic. So we know in the first wave there were many hospital second-line services that were stopped, and so we need to look at how do we keep those services going despite what's happening with the pandemic, and also secondly with respect to clinical organization, to ensure that our hospitals are able to accommodate the needs that we have with respect to the pandemic. A seventh strategy is with respect to purchasing, so ensuring that we have adequate protective equipment, both for the time that we need it and within our inventory, that we are able to access critical medication when we need it, that they're not, that we also have that in our inventory, so that our stocks are full and we're able to respond to the needs as they happen. And lastly is the last strategy is with respect to governance and communication of directives as they happen. So Quebec is looking at improving those strategies so that the information that they disseminate can get more quickly to the general population and to the health organizations that administer those directives. So this is a summary, of a very brief summary of, oh, sorry, I forgot the ninth strategy. The ninth strategy is really focused very clearly on communication, and so informing and sensitizing the population regarding prevention strategies as they exist, ensuring to diffuse and communicate information in a timely fashion, and that the information is coherent across the board. Those are areas that the Quebec government will be focusing on moving forward. So again, this is a quick summary of the second wave pandemic plan. There are many areas that directly impact Kahnawake, meaning that we also have those areas to improve upon, and there are other areas that we excelled in compared to Quebec for many different reasons. But again, we'll be assessing those and providing you with our own analysis for Kahnawake and how we will move forward in the future in the weeks coming. So just a few housekeeping items to mention. On Tuesday, Dr. Gauthier will be on Facebook Live, so we'll be promoting that as well on our Facebook site, asking you to submit your questions to her so that she can prepare them in advance and have answers for you next Tuesday. And on Tuesday, we'll also have a KMHC nurse, Juanita Belanger, who will be here. She is replacing Leslie as the infection prevention control nurse, and she'll be talking about many of the training areas that she'll be working with the schools on for both for teachers and for the students as well. And Robin Delaronde from the Ed Center, director of the Ed Center, will also be here next Tuesday. So I'm going to leave the rest of the housekeeping items to Joe. Thank you.
All right, thanks so much, Lisa. And next week will be a little bit busier than normal because she mentioned the Tuesday program, which will be really chock full of information. But on Monday, we're going to have representatives from Playground Poker and Poker Palace who will be in to talk about some of the measures that they are going to be taking to ensure a safe return to that business. It's going to be starting out much, much smaller. They've worked closely with the task force here to make sure that they can roll this out properly, and there will be evaluations taking place every week. There will be inspections that take place before they open up, and it will all be dealt with in a very, very careful manner. Again, we'll have representatives on Monday. Then on Tuesday, we'll have the program that Lisa mentioned. And again, on Thursday, we'll have another new update. So it's a busy week coming up. I know a lot of people are still very concerned about the start of the school season. Some of the kids from Kahnawake have started to go to school off reserve, those who are going into the city, for example. And we'll keep you up to date on everything that we can here at the task force. Just one more mention of a little housekeeping. If you're delivering anything to the Kateri Memorial Hospital Center, any of the patients or residents over there, this Sunday is the day to do it. It's every second week, and this Sunday is a time that you can drop them off. Remember, carefully labeled, and all of the directives are there on the website. You can look at them. It will go from 10 a.m. until 1 o'clock this Sunday at the Kateri Memorial Hospital Center. Just drive to the testing site, and it'll be taking place there. And they have some volunteers standing by. And that should do it for us. So on behalf of everybody here at the task force, we wish you all a nice weekend, because we are coming up to the weekend. And we thank you for watching, taking time to join us. We'll see you next time. Take care. Nyauko Adano. Onigiwahi.